Can OCD be diagnosed with a blood test? Have you ever wondered if obsessive-compulsive disorder, often called OCD, can be diagnosed through a simple blood test? The answer is no. OCD is a mental health condition defined by persistent, unwanted thoughts known as obsessions, and repetitive behaviors or mental acts called compulsions. Currently, diagnosing OCD involves a thorough clinical evaluation by a mental health professional. This typically includes a detailed interview, a review of symptoms, and sometimes the use of standardized questionnaires. At this time, there is no blood test available that can diagnose OCD. The process relies on careful observation and discussion of symptoms with a healthcare provider. While researchers are making strides in understanding the brain and genetic factors related to OCD, there is no scientific consensus or approved medical test that can confirm the disorder through blood analysis. Recent scientific research has delved into the brain mechanisms and genetic markers associated with OCD and other mental health issues. For instance, studies have identified hundreds of genes that may be linked to OCD. Ongoing research is looking into how these genetic factors interact with brain function and behavior. However, these findings are still emerging and have not yet been established for clinical diagnosis. Some companies offer genetic tests that claim to provide insights into how individuals might respond to certain medications used for OCD. These tests analyze genetic markers to predict medication effectiveness or potential side effects. However, they do not diagnose OCD itself. Instead, they are designed to assist in guiding treatment decisions after an official diagnosis has been made by a healthcare professional. In summary, OCD cannot be diagnosed with a blood test. The diagnosis is based on a clinical assessment conducted by a qualified mental health provider. While the research into biomarkers and genetic factors shows promise, these are not currently utilized for diagnosis. Anyone experiencing symptoms of OCD should seek evaluation and personalized advice from a healthcare professional. Ongoing research may lead to new diagnostic tools in the future, but for now, clinical evaluation remains the standard approach.